Over the last 24 hours, we identified 61 new cases and completed about 3,400 tests. Our positivity rate was about 1.6%. 16 more variant cases have been identified over the last 24 hours. There are alerts or outbreaks in 130 schools, which represents about 5% of schools in the province. Currently, 170 people are being treated for COVID-19 in hospital, including 36 admitted to the ICU. Across the board, our numbers are moving in the right direction. Cases, hospitalizations, ICU admissions, and our positivity rate are the lowest they've been since last summer and early fall. Right now, there are only 5 active cases in all the continuing care facilities in Alberta combined. That is a remarkable number. Earlier today, I participated in the first of 3 town halls to hear from residents, family members, staff, and operators of these facilities. We are getting their input on how this dramatic impact of vaccines should inform what health measures are necessary in these settings and for how long. There are now 1,132 active cases in Alberta, the fewest since August 26th. Sadly, I must also announce that 4 new deaths were reported to Alberta Health in the last 24 hours. My thoughts go to the family and friends of these individuals. I know the absences of those we've lost to any cause during the pandemic continue to be felt. I want to extend my deepest condolences for your loss. I know there have been some questions lately about reports of side effects from Pfizer and Moderna vaccines. So I want to provide some information on what we know about heart muscle inflammation after immunization. From Israel and from the United States, we have seen reports of a rare side effect of heart muscle and heart lining inflammation after Pfizer and Moderna vaccines, most often after the second dose, and almost always very mild. This side effect is being seen most often in younger people, mostly males. In Canada and in the United Kingdom, we have not seen the same trends, possibly due to the fact that second doses in younger people have not yet been given in large numbers. However, given what has been reported in other countries, here is what younger Albertans should know about this condition. First of all, young people who get infected with COVID-19 have about 100 times greater risk of experiencing heart inflammation than what is being seen after the second dose in Israel and the US. Second, the heart inflammation reported after the second dose is almost always very mild, resolving with anti-inflammatory treatment. Finally, in both countries where it has been reported most often, after rigorous review of all the evidence, advisory bodies in both countries have concluded that the benefit of immunization far outweighs the risks. COVID-19 is not over in the sense that we still have disease, we still have variants of concern, and we still need to watch to see how those variants intersect with the high and increasing levels of vaccine coverage that we have. I think one of the things that's really, really important for Albertans to understand over the course of the summer is now is the perfect time to access the protection that vaccines provide. We saw last year in the summer that the numbers remained low, that there's a seasonal component to spread. And so I think we should all anticipate that at some point we will see increasing numbers. The way to prevent those numbers from having a significant impact is to have as many of us as possible access that protection that vaccine offers and be a part of protecting our communities. Those are the kinds of things that we will continue to work on through the summer, that we will continue to ensure that Albertans have access that's low barrier to vaccine, that information is available, so that we can enter the fall with the best possible level of protection. The other thing, of course, that's really important to keep in mind going forward is that COVID-19, as vaccine levels increase, becomes a more manageable risk at a population level. And I think that's a shift that is going to be a challenging one, again, over the coming months as we see that vaccine level rise, that protection level increase. We need to be able to integrate, as I was saying earlier, how we think about COVID-19 in an individual and collective way as one risk among many others, because when we focus on COVID-19, as we have needed to do before we had vaccine coverage, when we focus on it in a dominant way, it takes away the attention and resources that we also need to be using for other health issues. So COVID-19 remains a challenge that we need to respond to, but over the next many months, the other task that we have is to try to integrate that amongst all of the other health risks so that we don't inadvertently cause other problems. So that we have those two challenges to meet that we'll need to bring together over the coming months. The advantage that we have in Alberta with the high first dose uptake and the rapidly increasing second dose uptake is that the case counts that we may see don't necessarily need to drive action like they previously did. And the reason for that is that we know that vaccines are highly protective against infection and even more protective against severe outcomes. So when we've seen the data from the UK, for example, we know that in the UK, cases have started to increase, particularly with the Delta variant of SARS-CoV-2, which causes COVID-19. We've seen hospitalizations not rising in the same way that they've done in previous waves. And in Alberta, we've had the opportunity and the advantage of offering vaccine to all age groups 12 and over in a significant way for over a month at this point. Whereas in the UK, when they saw the Delta variant begin to spread, they hadn't yet been able to offer vaccine to some of those younger age groups. So if we do see cases start to rise in Alberta, that doesn't necessarily mean that we're going to see severe outcomes rise in the same way. And without that correlation, it would not be appropriate to use those case counts with exactly the same thresholds that we'd used previously, because again, we know that COVID-19 is one risk of many, and we need to use public health measures only if we see a significant system-wide impact, which vaccines, by all accounts, even looking at the UK data, are going to be a significant mitigating factor. So we will be looking at all of the indicators, but particularly looking at impacts on severe outcomes. And if we start to see those impacts rise, then that will be the biggest concern. But cases alone, again, are not going to be something that we need to respond to in the same way, because we now have a much higher level of protection with vaccines. There's a period of uncertainty and anxiety as we move into this next phase. However, again, it's really important to think about COVID as one risk of many risks that need to be navigated as an integrated whole, rather than the one risk that dominates all others, particularly for kids who in general have an extremely low risk of severe outcomes.